Ultrasonography, often simply referred to as ultrasound, is a non-invasive medical imaging technique that uses high-frequency sound waves to produce real-time images of structures inside the body. It's a versatile and widely used diagnostic tool in various medical specialties due to its safety, cost-effectiveness, and ability to visualize soft tissues that may not be well seen with X-rays. Let's delve into its uses, limitations, and future in more detail. At its core, ultrasonography operates on the principles of sound wave propagation and reflection. A transducer, a small handheld device, emits high-frequency sound waves, typically 2 to 18 megahertz, far above the range of human hearing, into the body. These sound waves travel through tissues, and when they encounter a boundary between different tissue densities, e.g., a fluid and solid, or different types of tissue, a portion of the sound waves is reflected back to the transducer as echoes. The transducer then acts as a receiver, detecting these returning echoes. The time it takes for the echoes to return and the strength of the echoes are processed by a computer to create a real-time image on a monitor. Different tissues reflect sound waves differently. Fluid-filled structures, like cysts or blood vessels, allow sound waves to pass through easily, appearing anechoic, black, on the image. Solid structures, like organs, tumors, or bones, reflect more sound waves, appearing hyperechoic, bright, or isoechoic, similar to surrounding tissue, depending on their density. Air-filled structures, like the lungs or bowel gas, scatter sound waves, making them difficult to image clearly. The images produced are dynamic, allowing clinicians to observe organs in motion, blood flow, and the movement of structures in real time. Ultrasonography boasts an incredibly broad range of applications across almost all medical disciplines. Here are some of the most common and significant uses: obstetrics and gynecology. This is perhaps the most widely recognized application of ultrasound. Pregnancy monitoring. Confirming pregnancy and gestational age. Early scans can confirm the presence of a pregnancy, determine fetal viability, and accurately date the pregnancy. Monitoring fetal growth and development. Regular scans track fetal size, weight, and the development of organs, identifying potential growth restrictions or abnormalities. Detecting congenital anomalies. Detailed anatomy scans, typically around 18-22 weeks, look for structural birth defects in the brain, heart, spine, limbs, and other organs. Assessing placental location and amniotic fluid volume. Crucial for identifying conditions like placenta previa or oligohydramnios, polyhydramnios. Monitoring multiple pregnancies. Essential for tracking the growth and health of each fetus in twin or triplet pregnancies. Guiding procedures. Ultrasound is used to guide procedures like amniocentesis and chorionic villus sampling. Gynecological applications. Evaluating uterine and ovarian pathology. Diagnosing conditions like uterine fibroids, ovarian cysts, polyps, and endometrial abnormalities. Investigating pelvic pain and abnormal bleeding. Helping to identify the cause of gynecological symptoms. Assessing infertility. Evaluating the uterus and ovaries for structural issues that may affect fertility. And monitoring follicle development during fertility treatments. Abdominal and pelvic imaging. Ultrasound is a primary imaging modality for many abdominal and pelvic conditions. Gallbladder and biliary system. Diagnosing gallstones, cholecystitis, gallbladder inflammation, and evaluating bile duct obstruction. Liver. Assessing for fatty liver disease, cirrhosis, tumors, benign and malignant, cysts, and abscesses. Kidneys and bladder. Detecting kidney stones, hydronephrosis, swelling of the kidney due to urine backup, cysts, tumors, and evaluating bladder function and masses. Pancreas. While often challenging due to overlying bowel gas, ultrasound can sometimes visualize pancreatic masses or inflammation. Spleen. Evaluating splenomegaly, enlarged spleen or splenic lesions. Appendix, often used in children and thin adults to diagnose appendicitis. Pelvic organs, non-gynecological. In males, evaluating the prostate gland, transrectal ultrasound. In both sexes, assessing for ascites, fluid in the abdomen or other masses. Doppler ultrasound is a specialized technique that measures the direction and speed of blood flow. Deep vein thrombosis, DVT, the gold standard for diagnosing blood clots in the legs. Carotid artery disease, assessing for plaque buildup in the carotid arteries, in the neck, which can lead to stroke. Peripheral artery disease, evaluating blood flow in the arteries of the arms and legs. Aneurysms, detecting and monitoring arterial aneurysms. The future of ultrasonography promises greater precision, expanded applications, and increased accessibility, further solidifying its role